Angeline Young.
Being a key opinion leader in various fields and embarking on industry trials, the concentration I chose to major in, which is clinical effectiveness, was largely a consolidation of various fields that were essential to delivering better clinical care for patients that we see on a regular daily basis. Public health really has various spectrums. I was really more interested in delivering good clinical care and yet being able to also design clinical trials as well. So this concentration on this major allowed me to sort of learn the most, employ that back into my regular practice because I am ultimately still a full-time practicing clinician. So I think really being in Harvard, I think the key big thing was meeting various people from various walks of life. A lot of them were primarily physicians in my track because they were all into different specialties and were really very senior in the organization, and they were coming back to do their masters on a more part-time basis. I think I'm very, very fortunate that in my career I've had a lot of opportunity to really travel and work at the same time. So I've done 2 long fellowships. My first fellowship I was sent on scholarship to the UK on my HNDP scholarship to do skin cancers as well as most micrographic surgery. And my second stint where I really lived overseas for a long period of time was when I went to Mount Sinai to do my second fellowship in cosmetic dermatology and hair transplantation and hair disorders. So the 2 previous fellowships really gave me the opportunity to mix with dermatologists from both North America as well as from Europe and gain experience from both and understanding both healthcare systems. And that was primarily what really piqued my interest. So in terms of being able to experience sort of life overseas, being able to work in different healthcare models, I've already been able to do that in the previous fellowships. So this was really a culmination of all that, being able to sort of like see, sort of like having experience there and then coming together, having a Singapore model, an Asian model, which is a hybrid system, having a UK model, a completely universal healthcare model, and then having the US, which is a very private payer, insurance-based model, come together and then help you understand from your personal experience and now going in as a senior physician and working with other colleagues around the world as well to sort of figure out how things are deployed and how systems are built in various countries depending on context, made it even more fruitful and more rewarding. What was really inspiring was the level that everybody was at. I think the desire to do more and to push beyond, I think I never felt it more strongly than when I was in Boston. I think it's really, truly an arena where you meet very, very good minds and together you sort of like forge together sort of a common path or destiny to provide better healthcare. What was really amazing was not just the professors that taught us, they were the sharpest minds in the country, but really meeting people who were very passionate about what they did. What I really enjoyed was to see everybody united by that common desire to go beyond themselves, to stretch themselves that much more. I think that was really inspiring to see people who were really driven by passion. Sometimes when you are sort of very confined within the context of a country, you don't see it very evidently, and we're very privileged in Singapore. We have good healthcare systems, we sometimes don't take that for granted. And actually very interestingly, we're oftentimes, being from Singapore, posed with a lot of questions about healthcare model because there are a lot of US professors or doctors in public health that are very interested in the Singapore healthcare model. And they see it as one of the success stories in the world. It is a small island city-state, but we have globally a very good reputation for having a very robust healthcare system. And I think that there's a lot to learn from the way we roll out policies as well. And so representing Singapore in a very sort of global context as such, really you find that people are really interested in talking to you about, what would your country do in a situation like that. Coming back, I think it really helped me a lot. It's certain basic things such as like reading my journals, understanding the clinical trials, being able to design them better myself, being able to really tease out what is fact and what is fiction. So I was able to critique that a lot more, to be able to look at the pitfalls of certain studies to see where the limitations were before I bought in on whether a product could really do that or whether the new drug on the market was really worth its weight. And in terms of probably fondest memory, I think it would be really probably, I think maybe just Boston itself. I think Boston's a great city to be in. I've lived in New York for a period of time and I much prefer Boston. Boston is a very academic environment, everybody there is very young, vibrant. It makes me feel like I'm 10 years younger. So hanging around with young students all the time, who are very purpose-driven, who look at the world and say that I want to change the world. And that's really much the motto of the public health school, that you really want to change and impact lives. And you feel it all around, you aspire to do a lot more. So I think it's that aspiration, it's that feeling that people here want to go beyond. And what I'm really grateful for is to be able to have the opportunity to experience that, so that when you come back, you don't get lost in your work as well. You start to remember sort of like, from a global standpoint, what healthcare is about, what it means to different people in different countries and different specialties. And that's something that I will always remember fondly.